I'm Missy Dixon from the University of Utah, and I'm here today to talk to you about strategies for managing disease progression, particularly in the cognitive symptoms. And I tend to view this as promoting resilience, both for affected individuals and family. So I think it's important to start with an understanding that DM does affect the brain. It is a brain disorder. It affects thinking and behavior. We need to, and some of the key points that I'm going to discuss further today are, managing, having knowledge of your DM symptoms, what those cognitive symptoms are, being aware of how they change over time. Also being aware what contributes to some of the cognitive problems that you might be experiencing. This understanding of your symptoms in the context of a biological, psychological, social construct model. And then building resilience, so how you can move forward, understand your symptoms, and live a healthy and happy life with that. And I call that promoting resilience to manage disease progression. Oh, I'm going the wrong way, sorry. So just a recap, I'm sure you are all aware of what some of the cognitive symptoms are, but I will just quickly go through some of them. So there's mood, that can be depression, anxiety, apathy, and flat affect. Thinking and concentration can be affected, so thinking is not always linear. Sometimes it's circular, sometimes it's completely disjointed, tangential. Attention can be affected. That can be visual attention, verbal attention. Language, information processing speed, so how quickly you can process visual information and verbal information. And then visual constructual abilities, so being able to put things, to construct things, visual spatial understanding where you are in the context of your environment. And then learning, so there's some verbal learning problems, perseveration, and personality changes. Additionally, executive function, which we talk about quite often. Executive function can be working memory, planning and organization, monitoring behavior, time management type skills, inhibition, so just saying whatever comes to mind and not holding back. Shifting from one task to another can be difficult. I said inhibition, I wrote that twice, sorry. Emotional control, so feeling those emotional ups and downs. And then visual verbal memory, motivation, so just getting started on a project, initiating that. Problem solving can look like decision making, and sometimes that's difficult because we perceive to have too many choices. So what does the cognitive change look like? For some people, for most people, it's gradual, and it's subtle changes over time. And I think Cynthia reported some data on that from their study yesterday. But to caregivers, it may look pretty extreme because you're not noticing all the effects of that, or the people that you're caring for are keeping that to themselves earlier on, so that change may appear to be pretty extreme. Symptoms can look different at different stages of development and throughout the course of disease, so it could depend on certain environmental factors or what's impacting you at the moment, what's going on with your family, what's going on with other physical symptoms, and they all play a role in cognition. And again, those symptoms can wax and wane, and that can be both psychosocial components to that and environmental components to that. So cognitive symptoms can also be similar within DM, and they can also be individual because we're all unique individuals. So some contributors to cognitive change. So this is the biological, psychological, and the social components. So some of the biological things that may be affecting cognition are just the disease mechanism and the severity. Physical symptoms and limitations such as sleep, fatigue, the GI piece, cardiac problems, pain, they all play a role into cognition and those changes that you may be experiencing. An example might be if you're having a lot of GI symptoms, it may be hard to pay attention to something that somebody's telling you, so it may look like you have an attention problem, but really don't have that much of an attention problem. It's secondary to your GI symptoms. And health complications and medical regimens. So, are you on BiPAP? Do you have to take medication at this time? If you're attending to those things, it may look like you have cognitive change secondary to some of the biological components. Psychological components that can contribute to cognitive change are thoughts and emotions and behaviors. And so just experiencing the disease and the ups and downs of the disease can cause psychological distress. You can have fear or avoidance beliefs, so particularly if it's a snowy day and you're fearful of falling, that may be what you're focusing on. Coping strategies, self-esteem, and self-efficacy, this belief that you actually have the skill set to do the things that you know that you can do, also play into cognitive change and how we approach it. And then social factors that can affect cognition are environment. So what is it like at home, in your community, at school and work? So these bigger systems that are at play. Relationships, so your family, your peers, your support network, that's very important. And that's obvious by how many caregivers and affected family members who are here today. And then cultural factors also play in, so work and family and just financial resources that you have to devote to symptom management and disease management. So it's important to understand cognitive change in this holistic approach, which I've just described earlier. So the biological, the psychology, and the social context all contribute to your health, and they all contribute to those cognitive changes. And so what's important is building resilience. And Cynthia alluded to this. What's important is, that you have caring and supportive relationships. That's a primary factor in building resilience. And so that encompasses your team. And that's not just your family and your friends, your support network. It's your healthcare team. It's people you work with. That's a primary factor in building resilience and attending to cognitive component. So communication and problem solving are also important to building resilience. So we want to have this continuous open dialogue about what your symptoms are, and how they're progressing, how you're getting through your day. What's important on this day may not be important on the next day. So to continue that dialogue and keep it open is very important. An important piece of building resilience. Start conversations early. So don't wait until you actually have you're in the crisis mode of trying to attend to managing some of the cognitive symptoms. Think about, just based on some of the literature, what those symptoms might be, and maybe get a plan together with your caregivers and with your family and your friends about how you would like to address them. Because then by talking about them early, you have more control over that, you have a plan in place, and so that when you do start to notice the decline, two things: you already have this open relationship and opportunity to talk about these things with your team, and and then you have a plan in place for how you'd like to move forward. And then I think something that often doesn't get talked about is caretaking the caregiver. So this is, maybe your caregiver has a lot going on. Maybe they're caring for, more than one individual who has DM. Maybe they have it themselves. And so this idea that we don't want to share our symptom because we don't want to be a burden on our caretaker or on our team. This disease is really a team approach, and so the more open you are with each other, the better able you are to support each other. And so I call that caretaking the caretaker. It's not always helpful. It is helpful to make realistic plans and steps to carry them out. And again, to do that earlier than later so that you're not attending to crisis mode, but you have a plan in place prior to experiencing some of the symptoms. So that includes understanding what that disease progression is, what it might look like, what some of the symptoms can be, to talk about those symptoms before they come on. I can't reiterate that enough. And to make an approach plan so you're prepared and it's not in the crisis moment. You want to address strong feelings and impulses. So this is also important. I think Cynthia kind of alluded to it, or not kind of, she did allude to it earlier in a different way. So I'm talking about it in terms of like mourning the change or loss of function and moving on. So that those ups and downs that you have, each day it's probably something different. Sometimes it's a loss of function for good, or that cognitive change may be there, and it's okay to be upset about that. That's normal. That's healthy. It's okay to share your feelings about that with your team, and it's okay. And by doing that, that helps you move on. It helps you move through those stages of acceptance and understanding and being angry about it, and then getting proactive and moving forward. Let's see, and I think a very useful coping strategy to any disease or any setback cognitive management tool is to use humor, or to find humor in your everyday existence and some of your symptoms and some of your stories, and to use that as a coping mechanism, and that's healthy. And to be able to laugh with your family and your friends and your team about things that are going on is a very healthy approach to managing your symptoms, and also to maintain perspective. So sometimes that can be a little difficult when we're in the moment, but to understand that, maybe you're experiencing a cognitive change at this time, and it might seem like the end of the world, but if you step back, the bigger picture is it's not that bad, it's manageable, and if you're able to gather your team, talk about it, be proactive, these are ways that you can maintain perspective. Okay. So again, additional strategies to build resistance to address your cognitive change. You want to strategize ways that work for the individual. and do that in group context, and also know that if you're the one experiencing the symptoms, you're the expert on you. And people cannot read your mind, and so it's helpful if you share those with other people, and then you can brainstorm about what might work to help and ways to change. Particularly when we're talking about memory problems or memory changes, we can do certain things in working with individuals. We can shorten sentences. We can slow down how we speak. Sorry, I'm a fast talker. We can give clear instructions. We can divide information. So earlier, somebody was talking about, helping his daughter get to school or get through school, and it was joining in. So that helps with that initiating and then breaking down information to little chunks that are manageable. So that's that dividing information. We can use visual cues to help process information. So sometimes, just having an auditory cue isn't enough, but the more information that we can provide in different formats is really helpful. People learn in different ways. Some people are auditory learners. Some people are kinesthetic learners, so they have to do it themselves, and others are visual learners, and some like a combination of both. And something that we don't necessarily know in DM is, do you start out as one type of learner, and as your disease progresses and you experience cognitive change, does it change how you learn information? The answer is probably yes. And so giving as many possible options for learning is important. Checking in when you're talking and providing instructions or having conversations, check in about things. Do you understand? Are we on the same page? Give people an opportunity, both from the affected individual and the caregiver side, to have that conversation to make sure that you're on the same page, so that give and take. But also, in doing that, you can reiterate back the information, and that helps synthesize that into your memory. So ask for information to be repeated, helps with verbal memory. Summarize and repeat information is important, and introduce new information in steps. So, rather than throwing out the whole big, long instructions or timeline or whatever it is that is coming at you that can seem very overwhelming, break it down into steps. So extra time for instructions, extra time for conversations, include the caregivers, include the team. Making lists and checking off completed tasks can help with some of those memory problems. And, it doesn't always have to be the caregiver doing that. It can be you doing that yourself if you're affected. And so that's a way of participating. It's a way of continuing to crystallize that knowledge and that information that you're taking in. Allow extra time for transitions. So I think this is something that becomes difficult and then can contribute to feelings of always rushing, always late, failure, fatigue, this idea that, transitions are hard, and they're hard for everybody, but particularly if you're experiencing cognitive changes or physical disability, it's important to allow extra time for transitions so that you can be successful and you can transition into either the new activity or wherever you're going or new conversations and feel successful. It's important for some people to help get things started. So initiation, oftentimes it seems like people are described as lazy, or they just don't want to do something. And so it's really initiating that task. And oftentimes it's not that somebody doesn't want to do it, it's just for them that executive function of initiating a behavior is impaired. And so, if you have help to do that, to get started, the people are happy to go along with that. You want to create a system for organizing and planning, and that can be done collectively as a couple, as a family, with your care team, with your healthcare team. And that could look like using lists and calendars or agenda planning. There's creating a system with checklists and self-monitoring, and then asking for help in monitoring that and being accountable. So holding yourself accountable and having your team, feeling accountable to your team. And I think something that's really important, and I noticed I made a mistake here, but repeat, repeat, repeat. That's very important. So what might take one person one pass at getting the full instructions and understanding what's going on may take somebody else 3 times. So in a particular example might be, if you tell your child to go to their room, pick up their socks, and grab their coat and come out because you're leaving, one thing is they may struggle and they may just do one of those tasks. And so you have to repeat it again. And so, this example speaks to this idea of chunking information and breaking it down so that everybody can feel successful and satisfied, but also just that repetition of information helps get it in there and crystallize that. So with that said, here's my mistake. Same slide. Repeat, repeat, repeat. So additional ways to build resilience to address cognition and cognitive change. We want to understand that, emotional reactions to the progression of disease is normal. That's normal. And it's normal for both affected individuals, and it's normal for the caregiver, and it's normal for your extended team. And again, back to this idea of mourning loss of function and moving on, and understanding that that's not a linear process. And what, for me, maybe, I need to say 2 words about it and I'm over it. It may take somebody else a little bit longer to get over it. And so it's that idea that we're all individuals, and we each have our own process in getting through something. But to keep those lines of communication open helps with this process. It's also important that activities are planned so that affected individuals, so you can feel successful. So again, that's giving yourself enough time, creating a positive experience, because what do we know about positive experiences? We want more of them. So, if some sort of activity is planned where it's difficult for you to engage or to physically get there, sometimes, that's not going to be a positive experience, and so then you may not want to do that anymore. And then is that really, we may consider that apathy, but it may not actually be apathy. It may just be opportunity. So, and also by doing, by creating these positive experiences, we have an increased sense of control, and that leads to increased motivation to continue. And by creating a positive and healthy environment, it helps foster healthy relationships, it helps with communication, and it positively impacts your emotional health and your physical health. And so One thing to think about in terms of building resilience is that both, well, I say child here, but patient, participant, adults, caregivers, you exist within a larger system. And that system is your family, it's your community, it's your work community, it's your health community, it's this community, it's where you live. And so these are all important systems to keep in mind, that there are opportunities there for you to build resilience. And levels of family stress are related to a patient's illness. So if you can find ways to mitigate stress, and again, I talked about some of them earlier, and I really think that it goes back to open dialogue, and getting your care team together and focusing on the overall team. That's an important way to reduce stress, not only for you, but for your caretaking team. And issues include, oh, this got cut off, sorry. Issues include uncertainty about what to communicate to the, because of caregiver burden. There's anxiety, there's financial strain, and there's caregiver and individual reactions to that. And so, those are contributors to stress, individual family system stress. And so, again, it's important to talk about those, and to share what some of your anxieties are, and to put a plan in place to work through that, to help manage your cognitive symptoms. One of the things that we see sometimes is this mutual pretense among caregivers that some of these things aren't necessarily happening, or we're not willing to share information about the reality of some of the disease symptoms and cognition. So I think it's important to, again, create the open dialogue and have honesty, sharing of that information. And then there's parent and caregiver accommodation that can oftentimes come in and interrupt that resilience piece. And so individuals who are affected and experiencing the symptoms, maybe they don't want to be taken care of all the time. Maybe they just want to be understood that this is something that they have, and to have this opportunity to work together with the team to work through what some of those symptoms are and how to manage them. So that gives them more autonomy in their process. And so building resilience, I just like this. I think, as a psychologist, I think that's, it's important to get help, and it speaks to this larger idea of, you're not an individual experiencing this by yourself. You have a team, you have caretakers, you have a psychologist, whoever is on your team, your healthcare team. And so, as a psychologist, I think it's important, that somebody is on your team to address the cognitive function, to understand what those changes might look like for you. And so to include a psychologist in your multidisciplinary team is important. The role would be to coordinate with your neurologist, with your rehab team, with your other medical providers, so that you can get a comprehensive approach to your care. And then another role of the psychologist is to assess this your emotional, your behavioral, your social, and adaptive functioning, and to understand where you may be struggling and what we can do for you. And then proactive screening, so that kind of goes to that emotional thing. So we can stave off, a deep dive depression by understanding that some things are coming down the pike that are big changes and they're affecting you emotionally. And then also to provide brief and targeted interventions in these particular instances. Oh, I'm going the wrong way. And so these are some factors that are family related and individual factors that are definitely specific to building resilience and things that you should keep in mind. You know, having some self-determination and independence is fostered through this care team by developing your team. Having developmentally appropriate communication. So some families here have young children, some have adult children, and so what's appropriate to communicate to your team, and how do you work together? Presence of social support. So again, the team, your healthcare team, your caretaking team, your friends, your extended family. Engaging in social activities can help create and manage cognitive symptoms, and finding benefits in your symptoms and being able to laugh about them, among other things. And I think this is my last slide. So individuals with DM can be at higher risk of experiencing psychological difficulties related to your disease and your cognitive change. They can be related to physical change, cognitive, executive function, your emotional experience of living with the disease and maybe being parents of children with the disease, your interpersonal relationships and how you share information and interact with each other. So it's important to integrate psychology. It allows for preventative practices and early intervention, and there are numerous factors associated with the resilience, and to name a few that we've already talked about, but the take home is appropriate communication, fostering independence, increase your social engagement, expand your team with your support systems. And that's my contact information, and thank you. I know that was a lot of information.